Traditional drugs for rheumatic disease treatment are largely quite old drugs. They're small molecules that are usually absorbed through the stomach, but they have quite a wide range of actions in the body, which means they also have quite a wide range of side effects. On the other hand, biologic medication are much more clever, complex molecules. They're much larger molecules, more targeted towards the root cause of the inflammation. Often they'll act on one receptor only. Consequently, they tend to work much better with fewer side effects than old-fashioned medications. They are, however, mainly given by injection because they can't be given through the stomach because they would be broken down by the stomach. So in rheumatology, first of all, we have to have a confirmed diagnosis of a specific rheumatic condition, such as rheumatoid arthritis, axial spondyloarthritis, or psoriatic arthritis. And in order to confirm that diagnosis, we normally need to find certain patient characteristics that will tick various boxes. Once we've got a confirmed diagnosis of one of these conditions, we usually try conventional disease-modifying drugs such as methotrexate or sulfasalazine first. If people can't tolerate those, or if they don't work, or if they don't work sufficiently, and people have then still got active disease, we can consider biologic drugs. But we have specific disease activity scores for the various conditions. And again, these will give the doctor an idea of how active the condition is. And then if appropriate, we can proceed to biologic medication. We usually reserve biologic drugs for people with more severe case of arthritis, because although they're very good medications, they do have some potentially serious side effects, so we need to use them appropriately. They're generally a good form of treatment if people have got coexisting conditions such as psoriasis or inflammatory bowel disease, which quite often occur in people who also have psoriatic arthritis or axial spondyloarthritis. Most biologic drugs are usually given by injection, often through an injector pen device that patients can give themselves at home, but occasionally an infusion that has to be given in hospital. So the fact that it's an injection can sometimes be a barrier to people who don't like injections or who have difficulty in doing them. But for most people, that isn't a problem. Now, with biologic drugs, although they are very effective, one of the mechanisms that they use to work is by suppressing the immune system. So consequently, people who are on biologic drugs can have a slightly increased risk of infection. Now, in the recent COVID pandemic, that's been quite an issue, and we need to be very careful with people who are vulnerable or at risk, making sure they've had all their vaccinations, etc. But also people who are generally prone to infections such as chest infections or urinary tract infections might not be suitable for biologic drugs because they can suffer more infections as a result. However, on the other hand, whereas people who have pre-existing liver or kidney disease might have difficulty with conventional disease-modifying drugs, biologic drugs are generally better for that group of patients. And finally, they are much more expensive options for treatment, so we don't use them in everyone, and they're not usually used in people with milder disease. So biologic drugs are generally effective for most people with rheumatic conditions, but it does vary from condition to condition and from person to person, so not everyone will respond to the same medication. Roughly speaking, with all these drugs, it takes about 3 months for an improvement to be felt. So although some people have a more rapid and impressive response, it's important not to be disappointed if you don't feel better immediately. Now, in terms of how well they work, roughly about 20 or 30% of people have a very good response and really get a significant improvement. About another 40 or 50% of people certainly do get benefit, but it's perhaps less dramatic than the people who've responded really well. And then a final 20 or 30% of people don't actually respond very well at all to the first drug that's tried. Now, that's not always a big problem because we've got lots of different biologic drugs. And so we can, if one doesn't work, we would move on and try a different one with a different mechanism of action.